We'll get to this conversation now. There are many states across India that are still in some form of lockdown or the other. And while our memory tends to be short, we must remember that the lockdown has caused a disruption of many services that we've taken for granted. But there's one report that got my attention, and I do feel it's something that needs to be brought to your attention as well. A recent study conducted by the Population Council on contraceptive demand and uptake among women suggests that 80 lakh condoms in India and 40 lakh pills, which are usually distributed, weren't in fact distributed. So there is an entire sort of infrastructure of distributing condoms, of gynecologists helping people get IUDs, of access to care and access to services that completely broke down apparently during the lockdown. And there are several studies that have led to a belief that this is going to cause a spurt in the population growth of India. It's an extremely interesting topic to talk about, and I personally think there's no one better than Poonam Muttreja, who's the Executive Director of the Population Foundation of India. Ms. Muttreja, good afternoon and thank you for joining me. Do you, at the Population Foundation of India, do you believe that we're going to see a spike because of a breakdown of that infrastructure?
We're going to see a big spike. I'm calling them COVID babies.
And this is not the WhatsApp joke because everybody was locked up in their houses with nothing else to do. But this is a
no. This is serious. This is serious. Yeah. I'm talking about numbers. So our estimation is that actually, which coincides with UNICEF global report, that there are going to be 20 million extra babies. And we already have a huge unmet need for family planning. So we have, the worst thing is to have an unwanted child, unplanned child. It is not only not good for the mother, but it's no good for the child and the economy of the household first. Indian economy has tanked, but even if we look at just household economy, and for women who are already overburdened during COVID, they are overburdened because of, caregiving roles, husband, in-laws, children are at home, and children across all class backgrounds, especially the poor, when the children don't have access to these wonderful classes on Zoom. So for women to get pregnant, and there are, and there's huge anxiety that goes with pregnancy. And during COVID, the anxiety will be huge of getting an infection and so on. Second, we are going to have a lot of abortions, which are back alleys, because that's another service. Condom and pills, their non-availability is linked to then an increase in abortions. In India, we used to have 16 million every year, 16 million. And can you imagine, in addition to those services not available for those 16 million girls, of course, many of them will have the pill, abortion pill, but abortion pill also often leads to people having incomplete abortions. So they need to go for services. So for both women who need abortion services and those whose abortions get botched, they need to go to good facilities. And there, in the good facilities, abortion services have not been available. So think of the morbidity and mortality that we are going to have amongst women. Second, if they do get pregnant, and for those who've got pregnant, you've heard so many stories in cities, women are not able to go and deliver in institutions. They must be all worried. How am I going to deliver? When am I going to deliver? Antenatal, postnatal services. So there is huge, it's going to be the worst. Pregnancy should be a joy, a pleasure. It's an achievement for a woman, actually. And an unwanted pregnancy is anything but an achievement. It's just a disaster for women with huge morbidities. I have a daughter who's pregnant, and she is quite, We're also nervous about, you know, getting COVID, infection, where you go, you should be, I mean, pregnant women are being told to be totally secluded. It's almost like they have to go into quarantine. How are all these poor women going to quarantine, please tell me?
Poonamji, let's take it step by step, if I may. My first question to you is, would you explain to us what the family planning infrastructure normally is in a non-COVID system?
Yeah.
And how could that have broken down during the lockdown? Because effectively, shouldn't it have been primary healthcare centers run by the government that was handing out all of these facilities? How did it break down? So what was that breakdown?
Yeah. Okay, so the breakdown happened because the distribution of pills in the households and condoms is done by ASHAs, which are the women frontline workers. And all the ASHAs, as then the second line is ANMs. ANMs even do insert IUDs, they distribute, they counsel, they
what is an ANM?
Auxiliary nurse midwife. So there are three frontline health workers at this point of time who are ASHA, ANM, auxiliary nurse. We have 2 million of them, more than 2 million. We have another 1.1 million ASHAs. And then we have the Anganwadi workers. So the total is 3.3 million. Now, these people are the ones who are actually our corona heroes, COVID heroes. They are the ones who are managing everything at the primary healthcare level for COVID. You know, not only healthcare, they're doing the enumeration, they're going household. All of them have to do 20 households and send the data to the government. They are the ones who are watching who's getting fever, who's getting a cold in every household in the villages. They are your surveillance, they are your quarantine managers, they are doing everything. And the last thing they have time for is family planning or any other services. Even services, they do services like prenatal care, postnatal care, they're not able to do because actually they are the ones who are, we made a film, in fact, on, we call them COVID, Corona Heroes. And this film, a 2-minute film on these 3 million people was the most popular film across the country. It went viral. So everybody in the villages knows and small towns know that they are the ones who are taking it. They're the go-to persons for COVID.
Yes.
So
and
therefore,
this breakdown of the care, because you say these primary healthcare workers, ASHA workers, midwives, Anganwadi workers were actually fully engaged in the battle with the virus. And you said 20 million extra babies from what we would otherwise normally in a non-COVID year expect. What does that take the total number to? And how much, give me a perspective on 20 million. How many is 20 million in comparison to what the normal number would be?
Okay, so the normal number of deliveries we have per year, there is the wanted delivery, and I will tell you about the unwanted delivery. The wanted deliveries that take place is in every year is close to 25 million. So we will have 20 million addition, but it is not just the services for distributing family planning products. It is also 75% of the women, the family planning method that is used is sterilization. And sterilization has totally stopped. That as a service they've stopped because there is fear of COVID. But also the second reason, to go back to your earlier question also, is that people are not going to health facilities. They're seeing health facilities as places for COVID, especially community health centers and district hospitals, but also primary healthcare centers. In fact, people are actually looking at these frontline health workers as spreaders of COVID because these people have not been given any protection by the government. They don't wear PPEs when they go and deal with the patient. They barely have a mask. And many of them have made the mask themselves. There is women, I spoke to a bunch of Ashas in Haryana. They're wearing their dupattas, they're making a mask like this out of their dupattas. So, so the number is huge because there is no service available.
So effectively what you said is we normally have about 25 million deliveries across the country in a year, but expecting an extra 20 million. That's an 80% jump in the number of babies that will be born
No. If that is the estimation, yes, the jump is huge. That's why I said you're going to have a COVID baby boom.
So that's accurate. We were talking about an 80% jump in the number of babies that will be born because of this lockdown.
Yes, your calculation is correct. Your calculation is absolutely correct. In fact, I hadn't calculated that much, but that is a fantastic calculation.
Wow. And this will then lead to babies being abandoned, girl babies being abandoned. It will lead to further poverty, further malnourishment, lack of education, all of these things that spiral out of this one problem. Is that correct?
Yeah.
I'm a little, okay, so I'm having trouble digesting this information. It's actually shocking. What is your expectation right now as the Population Foundation of India as to what happens to the poorest household because of this, and what happens to girl babies? Because invariably it's the girl baby who will face the worst fate when something like this happens. What do you expect will happen?
So they'll be hugely undernourished, and undernourished babies born from undernourished mothers, because there's a shortage of food also. Pregnant women are not going to be able to take care of themselves. And also the anxiety is going to add to the vulnerability of the babies. So you're going to have huge stillborn babies. You're going to have babies who are born will be undernourished. Undernourished babies grow up, girls especially grow up giving birth to undernourished babies. So you're going to have a cycle of undernourished children. And it's not just that you have undernourished babies, but they also have 50% higher rate of dying. They have a 50% higher rate of heart and many other non-communicable diseases. And third, you're going to have a situation that many of these women who have got pregnant, who didn't have access to family planning services, are going to go for abortions in unsafe areas, as I said. So we don't know how many women have succeeded. We don't have numbers right now of how many women who would have got pregnant have succeeded and in going for abortion services. So how many of them will survive the abortion services? Because abortion will not be, by and large, in public health or private health facilities. The private sector also let us down. They close. Otherwise, the poor would have gone and taken, debts to go for abortions to the private sector. But much of that is also closed, especially in small towns and villages, out of fear of COVID. Okay, and of course, then on the other hand, a lot of people will accept to have a baby. Maybe the abortions will be fewer because they are scared to go for an abortion because they see it as risk to COVID. So there are these two very strange. I mean, it's in whatever way you look at
actually,
it.
I have to agree with you, because we were doing a lot of stories of healthcare in Mumbai, and Mumbai's tertiary healthcare centers, JJ Hospital, Sion Hospital, the KEM Hospital, were coming under tremendous pressure because a lot of the smaller nursing homes, as we call them, just closed. And so people had nowhere else to go. They would go directly to the highest level of care and at-home system. But I want to just, take a larger view of this, right? So there's been work that's been done in our country now for the last maybe 40 years between non-profit, NGOs and government. in an attempt to solve for one problem. And you touched upon that problem when you said that there's a cycle of undernourishment. And I honestly believe that this is the biggest problem India faces. We underfeed our girls because we prioritize food for the boys in homes. The girls are then malnourished. A shocking number, more than 50% of the girls in India are anemic. They're married at a very young age. They have babies in their teens, and their children are then born underweight and more vulnerable to small avoidable things like diarrhea, which causes death, malnourishment. And because they are not fed enough between the ages of 0 and 5, they actually don't develop enough to truly see their full potential. So we're giving birth to generations of Indians who cannot compete with your daughter's baby because they're just not fed enough. Their brains don't develop enough. They don't get the food that they need. And so they're sentenced then to a lifetime of poverty because there is nothing, it doesn't matter what opportunities you give them as adults, they can't compete. Is this going to set us back in the work that has been done by the country?
Totally. Totally. It's going to.
By how much?
Sorry?
By how much? Set us back by how much?
Set us back in, our health systems are going to have to cope with many more numbers. They're going to have to cope with many more children who got undernourished, not only because they were born undernourished, but there are other children because of COVID, because of what you started the conversation with, all the migrants who've lost jobs, or all the poor people who've lost jobs. There is going to be a huge burden on the health sector. And we really have discovered that we have a fragile, now there is no more evidence we need to give, no more advocacy we need to do. I hope that our health system was already in ICU. So the consequences is we will have to invest a lot more money. And even there is a new committee, I don't know if you are aware, set up in Niti Aayog, headed by N.K. Singh, Mr. N.K. Singh, which is looking at doubling the expenditure on health. But you know that doubling is not going to be in real terms doubling because our problems would have increased so much. Now on the family planning, it is a big setback for women in terms of women's empowerment. When I say women's empowerment, it means that many more girls will stay home to help the mothers with looking after the babies. There are girls who are not going to go back to school for not only the reason of family planning, but as you know, in itself, we know after Ebola globally, and whenever there is any form of crisis, including a natural disaster, girls do not go back to school. A large percentage of girls do not go back to school, and they will marry early. There will also be trafficking of girls. There will be more trafficking for girls. So, you know, whatever way we look at, the dice is loaded against girls and women as a consequence of this neglect. Now, you know, I am very sorry to tell you that even though many of us, this data that you quoted from Pop Council, this data has reached the health ministry at the state level, at the center level. They tell us, Acha, why don't you make some little films and, you know, do some behavior change communication? You know, how are we even going to reach women right now? Okay, we've done some WhatsApp, but that's not the solution. And you know what? We did not need to stop. We could have asked the Ashas. Ashas were given 1,000 rupees extra to do the COVID work. We could have given them 5,000 rupees extra and said, keep doing the distribution of contraceptives, in fact, increase, because other services like IUDs and sterilization are not available. And even right now, you know, when we speak to people in the health ministry, they do not see an emergency. They do not see the need to bring in more. For instance, there are contraceptives, temporary methods available, which are very easy to use. For instance, injectables. Okay, but injectable is only 3 months. in a situation like this, it'll be great if we had implants. You know, implants, you can just take one injection on your upper arm for, it lasts for 3 to 5 years. There is one for 3 years, one is 5 years. So my debate with the health ministry folks was, why don't we quickly bring it in? Because ICMR studies have been done. And so he said it'll take 4 or 5 years. That's the attitude. We have to quickly change our attitude. What will make our attitude change quickly? And we will, at this point, introduce implants, which will help large number of people, because everything is set. You know, we've had trials, ICMR approval, everything is there. Why can't we hurry up? If ICMR can ask for the vaccine to be ready by 15th August, which is not possible. I think probably because they thought our Prime Minister can announce over there. Why can't our Prime Minister announce on 15th of August that we will introduce implants? The priority, I don't know what it is. You're doing a program because this figure shook you. Why is it that it's not shaking our administration, our government, our public health system? I fail to understand, though I work on it, but I'm very frustrated at this point.
What can citizens do? People who are watching this right now, what can they do?
Start making demands, start writing to your health ministry that we don't need more children in this country, especially since women don't want to have more than 2 children. And we can't afford to bring in children, babies, or in such a fragile situation of COVID. So can we, the young people in India, first practice family planning, go to your family members and help them access contraceptives from shops. They are available in shops, and also make demands of our public health system. But demands of public health system, collective action will lead to something. But in the meantime, support every girl, whether she works in your house or she's in your neighborhood or a classmate or a student. Especially young girls have less access to family planning services than older women. So try and protect the younger women from getting pregnant at this point of time, especially during COVID. Let's not have more babies. It is not safe.
It's not safe. That's very well said. To just put it in a nutshell, this is what we have arrived at, an information that has shocked me through this conversation. We're expecting from studies 80% more babies to be born because of the lockdown than what would otherwise be expected in this country. These babies are likely to be born in poor families because they have lost access to birth control and family planning through the lockdown. The government has not paid attention to those who are working in the sector and has not done enough to help out. What we can do, 3 things: demand and talk about it. Tell more people about this problem. Read about it, talk about it, demand more action from state governments and central government on what can be done in this area of family planning on priority, because it is the well-being of the entire country that is at stake. Talk about it, demand more, and support the girl child. Make sure that all the little girls who are within your area of influence, so people who work in your home, children of the people who work in your home, make sure that they're fed. Sponsor food, sponsor books, and if they're teenagers, talk to them about family planning, give them access to family planning. We can make a world of difference if we just feed our girls with both empowerment, information, and food. Feeding the girls in India is the solution to so many of our problems. It's something we cannot take our eye off right now, especially since we have quite obviously messed up badly in the last 4 months. Poonam Muttreja, thank you so much for spending time with me and answering these questions. It was a pleasure. Thank you.
Pleasure. Thank you.